Hi. Think of a 35-year-old person admitted in a public hospital in Delhi with a massive heart attack. His family and friends are very worried about what exactly has happened to this auto rickshaw driver and what the outcome is going to be. So they asked the cardiologist, and she explains that there has been a blockage of blood supply in one of the main vessels of the heart. The blood vessel was damaged, and there was a massive clot that built up and that completely sealed off the blood supply, damaging the heart muscle. Now, that's a good mechanical explanation. But what caused all of this? So the cardiologist, she also explains that basically, having been a smoker of BD since the teenage years, that is what possibly caused the blood vessel to be damaged. An epidemiologist who does population-based research on the causes and prevention of a variety of diseases then chips in. Says, yes, smoking is one of the most important causes of heart attacks in young people, and it does create major damage to the blood vessels, but there could also have been other risk factors which piled upon this major risk factor. In this case, being poor, he might not have been able to get the right amount of diet, right quality of diet, might have had a lot of stress, physically inactive because he was an auto rickshaw driver, exposed to a lot of environmental pollution, and all of this could have combined to create the conditions for a heart attack. Now, a social scientist chips in and says, yes, poverty is the thread that links up all of these. And not only had this person poor access to health services and a greater exposure to risk factors of heart disease, but also had very little knowledge, very little health literacy with which he or she could have protected himself. So ultimately, the cause is poverty. The health economist comes in and says, yes, poverty is the cause, but something could have been done. What could have been done is to raise the tobacco taxes so that we have enough evidence all over the world that raising the price of tobacco products through taxes, especially BDs are undertaxed in this country, that could have reduced the consumption or even the uptake of tobacco in people with low disposable incomes, that is the poor and the young persons. So all of this should have been done. Now, how do we tie up all of this story? And that's where public health comes in. So even as the cardiologist is busy dissolving the clot or performing an angioplasty, we have to think of ways in which we can prevent more heart attacks from occurring in more people by tackling the various risk factors. It's not working. So, what is public health and how is it different from clinical medicine? Basically, what public health does is to look at the causes and the prevention of disease, but also the organization of health systems so that they can actually provide much better prevention as well as quality of clinical care, and acts upon all the determinants of health in society. Whether the risk factors could have been prevented, where health could have been promoted, water, sanitation, nutrition, all of these are important factors for infectious diseases. Could we have managed to have detected blood pressure and diabetes early on and provided treatment in primary health care, or provided appropriate referral to higher centers for appropriate treatment? All of this belongs to public health. Even when the person reaches a facility Are there sufficiently trained doctors, nurses, equipment, drugs, supplies to take care of the person? When the person gets discharged, can he or she afford the drugs and the nutritious food that is required for recovery? Are there rehabilitative services? So the entire construct of health services and health systems also comes under public health. So how did I make this discovery in my own life and make this journey from being head of cardiology in All India Institute of Medical Sciences to being a public health professional and an advocate? Well, the exposure started pretty early on in my life through a connection established from my parents. My mother was an obstetrician and a gynecologist who was looking after poor patients, both in public hospital as well as in a clinic, providing free service. My father was a lawyer who also was an avid reader and a scholar of sociology, political science, and economics, and brought in the broader perspective that a lot of what we do in our life is influenced by social, economic, political, and environmental factors of the society, and that we need to look at both of these. So I grew up with that kind of a binocular vision of health, and that is what made me appreciate, even as a cardiologist, that there is a great value in medicine, a great value in looking after vulnerable, sick patients, but we also need to look at health in terms of the broader societal dimension. Well, if you look, for example, at something that people identify with public health, that is immunization. We find that in India, only 64% of our children under 3 years are fully immunized, whereas the rates in most parts of the world are about 90%. We find that 38% of our children are stunted, 31% are undernourished, underweight, resulting in huge loss of cognitive brain power. And therefore, there is a problem with our health system in terms of delivery. Or is it the people are not following the right behaviors, or is it both? So this again, public health has to answer. When it comes to medicines, people think it's a simple matter of drug companies producing medicines, doctors writing the right prescriptions, and of people following the medication that has been prescribed. But in 2012, 38 million Indians were pushed into poverty because they could not afford the drug prices. Even last year, the National Health Policy document of India says that 63 million Indians are pushed into poverty each year because of unaffordable healthcare expenditure. So we need to create a system which can provide even good quality care with financial protection to everyone. So that is where, again, public health comes in. People say it's an individual choice. Most of these habits are individual lifestyle choices. Now, either you could wear a helmet or not wear a helmet. But is it a law and order problem for a policeman or a traffic cop to fix? It is a public health issue because you're trying to protect people from injury, from losing life and limb. Apart from that, when somebody has an avoidable, preventable traffic accident, these people are crowding the hospitals, occupying beds, using the doctor's time, using the blood bank blood supplies, which could have been used for other patients. So even road safety is a public health issue. Of course, not just the driver of the vehicle, but also the pillion rider must also be protected. Even for tobacco, often it is argued it's an individual choice whether you're smoking a cigarette or a bidi or chewing oral tobacco. But tobacco is an advertised addiction. It is a marketed malady. And there's a huge amount of advertising and marketing that goes on to trap people into this habit. So you need policy measures which can rescue people through ban on advertising, promotion and marketing, ban on smoking in public places, strong pictorial health warnings, raising tobacco taxes. All of these are important public health measures. in order to make sure that this kind of policy measures happen, we need to mobilize people. In 1998, we collected 25,000 signatures of students from Delhi schools, and their representatives went to the then Prime Minister, Shri Atal Bihari Vajpayee, and pleaded that your generation brought us independence 50 years ago. Please give us also a tobacco-free India. And then Indian Parliament passed a tobacco-free legislation and also contributed to a very strong global health tobacco control treaty. Now, when you look at issues of roads, it's not just road safety. We talk about physical inactivity as an important issue, that Indians are physically inactive, they don't do very well in most sports, they're getting obese, they're getting lots of diabetes, all of which could be prevented by physical activity. But if you do not have walking space which is safe on the roads, you don't have protected cycling lanes, protected pedestrian pathways, then our roads are going to be creators of ill health, apart from endangering road safety. So that again is public health. Diet. Diet is one of the most important elements in terms of health, nutrition. And we find that we need a very balanced and diverse diet. And we are told by the World Health Organization that we must have a minimum of 400 grams of fruit and vegetables per day, preferably at least 500 if possible. The per capita consumption of fruit and vegetables in India is 130 grams. So again, we recognize that we need to do something with our agriculture and food systems in terms of production, processing, pricing, distribution, marketing, so that junk foods are not marketed aggressively, but healthier foods are promoted and become easily accessible. So that again is public health. So when we are really looking at public health in various dimensions, we must recognize that public health is essential for everybody. Many people will need good health care in a hospital, and that must be provided, the right kind of care in an affordable manner. That's universal health coverage, and we must try for it. But hospitals are not the solution for health of a society. They're only a small part of that solution. Think of the automobile industry. If cars are repeatedly getting out of order, the automobile industry will not respond by building more car repair shops and garages at every street corner. They will say, let us build sturdier models which can withstand the stress. Let us improve the road conditions, remove the bad roads and potholes so that cars don't get damaged. Teach drivers better driving and maintenance of cars so that they can protect themselves. That is health. Build sturdier bodies with better nutrition, better physical activity, reduce exposure to dangerous conditions, air pollution, tobacco, alcohol, many other conditions that erode our health as we grow up, and give people the right kind of health information so that they can protect, promote, and preserve their own health. So that is, again, an essential component of our life and survival. And unless we bring in this broader public health dimension into our life, we will only be visiting hospitals more and more often and sending more and more people to those hospitals for care. We need to ensure that a health system is maintained which can provide preventive, promotive, curative, diagnostic, rehabilitative services, but bring in other sectors as well. Now, for example, we know that not only air pollution is damaging our health, but even climate change has become a major important factor in determining how our health will proceed. Not only major heat exposures that occur, but also our agricultural production goes down, the quality of our food production goes down. Our agriculture and food systems are also creating conditions for climate change, and climate change in turn degrades agricultural production. So how do we tie up all of these? Therefore, we must recognize that the lifeline of human health extends from the pulse to the planet. and try and influence all of these determinants at the various societal levels. Of course, public health cannot do all of it alone, but it needs to create and can create a platform to sensitize all other sectors also towards a common commitment to build a healthy society. So that's why, despite having been a serving head of cardiology in the All India Institute of Medical Sciences, India's premier institute, I decided that we must do something in terms of ensuring that we can actually build a better system. Just take life expectancy. India's life expectancy is the second lowest in South Asia, despite all our economic development. Our under 5 child mortality is 6 times greater than in Sri Lanka and China. So we need to fix our health system. We need to fix our policies so that we can actually create a healthy society. And for that, we created the Public Health Foundation of India, which now has 5 institutes, Indian Institutes of Public Health in Gandhinagar, Delhi, Hyderabad, Bhubaneswar, and Shillong, training public health professionals who bring in multidisciplinarity of knowledge for multi-sectoral application. So we have, for example, people who are medically trained but also come in from other sciences, nursing, nutrition, other life sciences. We also have epidemiologists, demographers, biostatisticians, health economists, behavioral economists, communication specialists, health technologists, and of course, health system managers, people with managerial capacity, social scientists, behavioral scientists. Unless we bring together all of these streams of knowledge together, we will not be able to create conditions for a healthy society, and we will not be able to also have an efficient and equitable health system which reaches out to everybody and provides the kind of high quality care they need with affordable universal health coverage. So our endeavor at this point in time is to try and bring in the world of public health into all sectors, but to ensure that even medicine flourishes well and does its job well in a competent health system which is enabled by a good public health architecture. Otherwise, medicine will remain the mopping brigade of policies and programs that have been messed up in other sectors. And we'll continue to be treating loads and loads of patients and wondering what has happened. So the future lies, I believe, in creating a healthy society by bringing all of these forces together with a common commitment. And unless we create that future, the present will extend itself, as Toni Morrison said, and we can't afford that. So towards a healthy India. Thank you.